struggling in bed, you're not alone. Erectile dysfunction affects millions, and it can be the first sign of a bigger health problem. In this video, we'll break down what ED is, why it happens, how doctors diagnose it, and the most effective treatments, from lifestyle fixes to modern surgery, explained clearly and scientifically. Erectile dysfunction, or ED, is the persistent difficulty in achieving or maintaining an erection firm enough for sexual intercourse. But more than that, it's often a crucial health signal. In this video, we'll provide a clear roadmap. We'll explore the physiology of how an erection works, the diverse causes of ED, the signs to watch for, how it's diagnosed, the full spectrum of treatments, and finally, prevention and prognosis. An erection is a complex neurovascular event. It begins with sexual stimulation, which can be psychogenic, a thought or fantasy, or tactile, from direct touch. This stimulation activates parasympathetic nerves, which release a crucial chemical messenger in the penile tissue, nitric oxide, or NO. NO raises the level of another molecule, cyclic guanosine monophosphate, cGMP, in the smooth muscle cells of the corpora cavernosa. This rise in cGMP causes relaxation of the trabecular smooth muscle and dilation of the helicine arteries. As blood fills these newly opened spaces, or sinusoids, the venous outflow is compressed against the tough outer layer, the tunica albuginea. This traps the blood, and rigidity follows. The reverse process is driven by sympathetic activation and enzymes, notably PDE5, which degrade cGMP, leading to detumescence, or the return to a flaccid state. The most common cause, especially in older men, is vascular. Atherosclerosis, or the hardening of arteries, can reduce blood inflow to the penis. ED is often an early marker of systemic vascular disease, sharing risk factors like hypertension, hyperlipidemia, diabetes, and smoking. In diabetes, microvascular disease causes endothelial dysfunction, impairing that critical NO signaling and causing structural changes in the cavernosal tissue. Neurogenic causes involve damage to the nerves from things like pelvic surgery, spinal cord injury, or diabetic neuropathy. If the neural signal fails, the erection fails. Endocrine or hormonal causes, like low testosterone, can reduce libido and impair erection quality. Thyroid disease and hyperprolactinemia may also contribute, but testosterone replacement only helps when a deficiency is confirmed by a doctor. Many common medications can cause or worsen ED, including certain antihypertensives, antidepressants like SSRIs, and some prostate drugs. Structural causes include Peyronie's disease, which involves fibrotic plaques causing curvature, and penile trauma. Psychogenic causes like stress, performance anxiety, and depression are often more common in younger men. A key clue can be the presence of normal nocturnal erections. Finally, lifestyle contributors are huge. Smoking, excessive alcohol, obesity, lack of exercise, and even poor sleep can all play a role. The key symptoms are an inability to achieve or maintain an erection sufficient for intercourse, decreased rigidity, and reduced sexual satisfaction. A loss of morning or nocturnal erections can also be a clue, helping to differentiate between physical and psychological causes. Red flags that require prompt medical evaluation include a sudden onset, penile pain or deformity, or symptoms of cardiovascular disease like chest pain. A doctor's evaluation starts with a detailed history, covering sexual health, medications, lifestyle, and psychological factors. They may use questionnaires like the IIEF-5 to track severity. A focused physical exam will follow, checking for things like penile plaques, testicular atrophy, and assessing vascular and neurological signs. Basic lab tests are crucial. These typically include a fasting glucose, or HbA1c for diabetes, a lipid panel for cholesterol, and a morning total testosterone level. For complex cases, specialized testing like a penile Doppler ultrasound may be used. This involves a pharmacologic injection to induce an erection, allowing the doctor to directly measure arterial inflow and veno-occlusive function. Treatment is personalized, starting with lifestyle modifications. Weight loss, exercise, smoking cessation, and controlling conditions like diabetes and hypertension can significantly improve endothelial function and erections. For psychogenic causes, psychosexual therapy, including CBT and couples therapy, can be highly effective. The first-line medical treatment is usually oral PDE5 inhibitors, like sildenafil or tadalafil. They work by blocking the PDE5 enzyme, preserving the cGMP that allows smooth muscle relaxation. It's critical to know these are contraindicated with nitrate medications due to the risk of severe hypotension. Always discuss all your medications with your doctor. When pills fail, a vacuum erection device, VD, is a non-invasive option. A vacuum draws blood into the penis, and a constriction band at the base maintains the erection. Intraurethral or intracavernosal prostaglandins are another step. A drug called alprostadil is delivered via a small suppository or a nearly painless injection to cause local vasodilation. For refractory cases, penile prosthesis implants offer a permanent solution with high satisfaction rates. Inflatable implants are concealed entirely within the body and allow for a controlled, natural-feeling erection. Finally, testosterone replacement is only for men with confirmed hypogonadism. It can improve libido and response to other treatments, but is not a primary fix for vascular ED. Answering some common questions. ED does not directly cause infertility. It is often reversible with treatment. And be cautious with unregulated herbal remedies. Always talk to your doctor. Remember, managing your cardiovascular risk factors is the best prevention for both your heart and your erections. Early evaluation is key. If you're experiencing ED, talk to your healthcare provider. It's a common, understandable, and treatable medical condition. Taking that first step is a sign of strength. If you found this video helpful, please like and subscribe for more evidence-based health explainers.